Women's bodies were designed to birth babies. It is just a fact of life that doctors today don't understand. For some reason, it is odd or courageous to give birth without medication, and you are strange for choosing to breastfeed instead of formula because you will ruin your body. As stated on babycenter.com, there's no loss of sensation or alertness. You can move around more freely and find positions that help you stay comfortable during labor, and you'll remain able to participate in the delivery process when it's time to push your baby out. For some men, they may not comprehend how evasive birthing a child can be. They may use a vacuum or forceps to help get your child out whenever they know what they're doing, and you don't need that extra push that they're trying to give you. Many doctors would prefer for you to have a major surgery than to wait out labor and let it happen naturally. From my own experience, I was 20 weeks pregnant and my OBGYN was already scheduling an induction. That was a red flag. I realized later she was wanting to induce me 4 days after my due date. If any women have been pregnant, you know a doctor's estimated due date could be up to 2 weeks off. It was a few days before Christmas and she wanted to stay home with her family. And I understand that, but your job should come first. So after that, I changed caregivers, and I was given a great set of women who did not discuss inductions till 42 weeks. Pitocin is a drug that they use to help induce moms that have not gone into labor. It also leads to epidural and cesarean births. Pitocin makes labor happen quicker, which can overwhelm the mother, which is a slippery slope to anesthesia. Epidurals are very common in today's birthing process. It is an anesthesia which is inserted in your back and it numbs you from the waist down to make childbirth easier. You may think, oh, that is perfect, sounds great, but as stated on mamanatural.com, epidural anesthesia also affects the baby in a multitude of ways. Changes in the mother's blood pressure following administration of the epidural can cause the baby's heart rate to go down. There are benefits and downsides to not having to deal with pain that you are made to handle. Epidurals can also cause fetal heart rate changes that may necessitate a cesarean birth, stress the baby's system in charge of excreting medications, affect APGAR scores, and increase need for resuscitation, and it can also impact early bonding and breastfeeding. Epidurals can go hand in hand with formula feeding. With the medication that affects the baby, it makes the child not be as alert or ready to attempt to breastfeed. With cesarean births, they are rising in the United States because doctors are very relaxed with it. The truth is, cesareans are major abdominal surgeries with side effects, including severe bleeding, scarring, infections, reactions to anesthesia like nausea and vomiting, and of course, a longer recovery time. MamaNatural.com discusses these issues with the rising C-section rate in the United States. If the mother or baby is in danger, I completely understand the need for the surgery. In some Texas hospitals, they have other forms of coping techniques. They had a big tub they use for water bursts, and a method that is only about a year old they offer laughing gas. I was the second person at Harris Downtown to receive the nitrous oxide, and there are no negative effects on your baby while using it. With my experience, I was able to rest in between contractions to prep for the actual birth. Labors can vary from 3 hours to 3 days. There is no way in telling how fast or slow your labor will be. Mine was 33 hours long, and it was on the longer side. Women's bodies are all different and all take things differently. In a research study on ncbi.nlm.nih.gov, in this case, strong evidence emphasizes the role of breastfeeding in alleviating pain in newborns undergoing venipuncture or heel stick procedures. These are multiple procedures a newborn has to go through in their first days of being in this world. I would like to say formula is not bad. I would just like to say that it is not optimal. Breast milk is made for our babies, while most formulas are cow's milk based. I know many babies are allergic to cow's milk. My daughter is an example of this. We would have definitely found out the hard way if she was on formula. A woman's milk also changes with the needs of our child at that time. It also helps build our little one's immune systems. When I first became a mom, I know I was terrified of SIDS, sudden infant death syndrome. It has been proven that breastfeeding lowers the risk of this. Breastfeeding creates a bond with our babies. It gives them nutrients and comfort. It is an amazing thing that you are your child's comfort and safe place. It is not just for babies, though. It actually reduces the chance of postpartum depression in moms and helps have a quicker recovery, reduces the chance of cancer, and you may even lose a little bit of weight while breastfeeding. And did I mention it's also free? Not only is it emotionally and physically beneficial, it is monetarily as well. Formula is really expensive, and all you need to breastfeed is you. And you make your own supply, and there's no need to remember anything else when leaving the house. These are only a few benefits of breastfeeding. There are many more as well. There are many resources a mother can take advantage of. There are classes centered towards natural births and breastfeeding in almost every state. Along with doctors, doulas are beneficial for the mother. Doulas are not required or anything like that, but they are great resources. And a doula is a woman who is trained to assist another woman during childbirth and who may provide support to the family after the baby is born. Also, lactation consultants are available at almost every hospital to assist with breastfeeding, with positions or items that you may need or want to help make it easier. Because breastfeeding is not easy. It's not easy, but once you get the hang of it, it gets a lot easier down the road. And my advice would be to know your resources and know your options. Our bodies were created to birth children. That's just plain and simple. And nowadays, it has turned into a medical procedure. I hope you take into consideration my points and reasoning when it comes time in your life to bring a miracle into this world or inform someone you may know.